These men and women are fighting a common enemy, COPD, chronic obstructive pulmonary disease. Their lungs don't work normally. Every breath taken can be a struggle. What do they believe to be the cause?
Too many cigarettes. Smoked too long, about 40 years.
I started smoking when I was about 17.
My wife says it's from 40 years of smoking.
That's true for about 85% of COPD cases.
We do see occasional patients that have various industrial exposures that can seem to contribute to that, but often they smoke cigarettes too, and so it's probably a combination of factors.
Consider what happened to 59-year-old Gregory Wright. As a firefighter, he was exposed to burning plastics, asbestos, and chemicals. Then he worked at an airport breathing in noxious fumes and gases.
Did you ever smoke? Yes, I did smoke for 30 years.
Another troublesome combination?
Asthma seems to be a predisposition that if you are an asthmatic as a child and then smoke cigarettes, then you have a fairly significantly higher risk of developing COPD later in life.
Then there's a particularly lethal mix, a genetic or hereditary predisposition due to alpha-1 antitrypsin deficiency.
I was diagnosed with alpha-1 in '99, but I'd had symptoms for years. And being a flight attendant, I had a hard time keeping up with the rest of the crews.
Although rare, people like Diane Kay have low levels of a so-called lung protector protein that's produced by the liver.
It took me forever to walk up from the driveway to get the mail. I'd have to take breaks, and you just think you're getting older, and at that time I was a smoker, so you think, you're older and you're smoking, what do you expect?
She was susceptible to colds, bronchitis, and laryngitis, and it took her forever to get over these illnesses. The early COPD symptoms are often missed.
Even people in their 30s and 40s will have the so-called smoker's cough. They think that's normal. They think everybody gets up in the morning and coughs up some stuff. That's not normal. That's the beginning symptoms.
Shortness of breath tends to develop in the late 40s and 50s. Diane finally had to give up her job.
They kind of frown on flight attendants walking on an airplane with an oxygen mask.
Eventually, it became so difficult for Diane to breathe that she ended up needing a lung transplant. Her advice? Don't smoke.
It basically caused me to have a transplant. If I hadn't been a smoker or worked in an environment with secondhand smoke, I probably wouldn't have had to have a transplant. I never would have gotten as sick as I got as quickly as I did.
For WebMD, I'm Rhonda Rowland.